My name is Aviva Olsavsky, and I'm an associate professor at the University of Colorado School of Medicine, and I work with the PROSPER program as a perinatal substance use consultant. In my work with moms who are using substances, I've learned a lot from our community and peer support organizations and people who've had lived experience in the community about the things that we do as medical providers which make people less likely to get care. And it's a really big problem. There's a lot of stigma. They're worried about a couple different things. They're often worried, they tell me about being judged and feeling like people think they don't care about their child, they don't care about being a parent, and that's just simply not true. People with substance use are just like anybody else. They want things to be better for their child compared to how it's been for them in their life, and they really want to make a difference in that child's life. I get it that you're scared when a patient brings up substance use and you feel like, I don't have an addiction medicine background, I don't know what to do or how to help them.
Hi, I'm Dr. Camille Hoffman. I'm an obstetrician and maternal fetal medicine physician and the consultant to the PROSPER team here at the University of Colorado. Even though we know that things like medication management or therapy can be overall simple, it doesn't mean we were trained to know how to do it efficiently in our clinical practices. When you call PROSPER, they're gonna help you know what's the next step and really walk you through what are those options for your specific patient that you called about in an efficient manner.
It can be incredibly complex when we're working with moms with substance use and their kiddos and their families, and this can be really, really difficult and can feel really overwhelming for providers. We're here for you. One of the most important things you can do as a provider is to use the skills that you actually already have to listen to them, to validate their feelings of what they're going through. We don't want to treat anyone for anything that we haven't been trained in. And so it can be really scary for providers when someone comes in and they're pregnant and maybe that person doesn't have experience treating people who have depression in pregnancy. And they're really scared that they're going to give them something that then is going to hurt the baby. And so that's why PROSPER is so important, because it's really critical to have someone to talk to be able to ask your questions so that you can then solidify your knowledge and make sure that you're understanding everything so that then you feel confident being able to treat perinatal mental health and substance use.
So I also know that I can call the PROSPER team if I have a simple question or a patient with more complex needs, and they're gonna be able to help me sort that out. From advice on prescribing to what our therapy, our substance use resources in the area, to what are recommendations for therapy groups online. Even if you're 7 hours away, 5 hours away in a snowstorm, you can still do something in your own community to help a patient. And I think as soon as an OB care clinician is introduced to that and realizes how easy it is, it's such a relief. It's such a burden off of your shoulders because you have a whole team to help you know what to do instead of just worrying about that patient and kind of getting in. Sometimes we can get in these spirals where we know we don't have anything locally, so what can we do? And you feel really helpless, versus this team can completely empower any clinician to help.
When you contact Colorado PROSPER, we really join the team that works directly with you to wrap around the patient and really to provide all of the support that you might need in your care of the patient, and to consider what resources might be needed for her to have the holistic care that both of you are looking for.
We know not everyone wanted to be a psychiatrist, so Colorado PROSPER is here to support you in meeting the patient where they're at and providing that evidence-based care and trauma-informed care, and it can make a big difference to get them access to care sooner. So give us a call at Colorado PROSPER.